Okay, real talk. The dental office is the last place most people expect a medical emergency to happen. But it does, and the DANB will absolutely test you on this. So today we are covering chapter 31, Assisting in a Medical Emergency, straight from the MDA 15th edition book. Hey DA besties, it's your girl Leela. Who else? Welcome back to
the DA Study Spot, yeah.
Okay, so chapter 31 is how you for your GC component, which is why we're going straight from the textbook today. So grab your notes and let's get into it. But before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it!
Okay, so the best way to prevent a medical emergency is to know your patient. That means open communication, complete and updated medical history, and current vital signs before treatment even begins.
So the book talks about medical alert notation. If it's in the patient's record, it flags a condition that needs special attention during treatment.
Now, most emergencies in the dental office are triggered by stress, a patient's personal stress or their fear of coming to the dentist. That's important because it means a calm, attentive environment is actually part of your emergency prevention strategy.
When an emergency happens, every team member has an assigned role, and the book is very specific about this.
The front desk calls emergency services and stays on the phone until help arrives. Either the assistant or the hygienist will retrieve the AED, the oxygen unit, and the emergency drug kit, while the other stays with the dentist and the patient to assist with assessment and basic life support.
Your role as a DA is to not diagnose. It's to recognize the signs, support the dentist, and execute your assigned task immediately.
Syncope. This is fainting, and it is the most common medical emergency in the dental office. This is caused by an imbalance in blood flow to the brain. Signs to look for: feeling of warmth or flushing, nausea, rapid heart rate, perspiration, pallor, and lower blood pressure. The medical response to this will be to first position the patient supine, subsupine with feet elevated slightly. This allows blood to flow back to the brain. Second, complete a head tilt jaw thrust to open the airway. Third, loosen tight clothing. Fourth, check oxygen. If below 94%, administer 100% oxygen. 5, have the ammonia inhalant ready. Wave it under the nose. 6, monitor vital signs. If unresponsive, call 911. 7, document everything. Postural hypotension, also called orthostatic hypotension. This happens when a patient moves to an upright position too quickly. Signs to look for would be low blood pressure and altered consciousness. The medical response to this would be to first position the patient subsupine with head lower than feet. Second, establish an airway. Third, slowly move them to an upright position. Fourth, monitor vitals. 5, document it. Angina. This is chest pain from the heart muscles being deprived of oxygen. Signs of this would be tightness or squeezing in the chest, pain radiating to the left shoulder, and or pain radiating to the left side of the face, jaw, and teeth. The medical response to this will be to first call 911. Second, position the patient in a semi-upright, comfortable position. Third, monitor vitals. Fourth, ready nitroglycerin from the emergency kit. 5, administer oxygen if needed. And then 6, document it. Acute myocardial infarction or heart attack. This is life-threatening and you need to call 911 immediately. Signs of this would be chest pain ranging from mild to severe, pain in the left arm, jaw, and teeth, shortness of breath, sweating, nausea and vomiting, pressure or burning feeling of indigestion, and generalized weakness. Medical response: first, call 911. Second, position patient semi-upright. Third, monitor vitals. Fourth, administer oxygen. Fifth, ready aspirin and nitroglycerin from the kit. 6, initiate CPR if patient becomes unconscious. And then 7, document it. Hyperventilation, which is rapid or deep breathing, usually triggered by anxiety. Signs include rapid breathing, dizziness, weakness or confusion, numbness and tingling in the arms or around the mouth, sweating. Medical response to this would be to first position the patient upright. Second, use a calm tone of voice to reassure them. Third, have the patient breathe slowly into cupped hands. This restores the appropriate oxygen and carbon dioxide levels in the blood. Fourth, monitor vitals. 5, document it. Now, we've talked about this one before, anaphylaxis, which is a life-threatening allergic reaction. Signs of this would be feeling physically ill, nausea and vomiting, shortness of breath, heart arrhythmia, sudden drop in blood pressure, and loss of consciousness. Since this is life-threatening, the first response for this would be to call 911, then position the patient supine, monitor vitals, start BLS if unconscious, prepare the EpiPen for administration, administer oxygen if needed, and then document it. Lastly, hypoglycemia, aka low blood sugar. Signs for this include mood changes, hunger, perspiration, increased anxiety, and possible unconsciousness. The medical response to this, if patient is conscious, is to give oral glucose from the emergency kit or concentrated orange juice. If unconscious, do not give anything by mouth, call 911. Then you're going to provide BLS if needed, monitor vitals, and then document it.
CPR follows the CAB sequence: compressions, airway, breathing. The book is clear. Start compressions within 10 seconds of recognizing cardiac arrest.
We do so by pushing hard and fast. You want at least 100 compressions per minute and at least 2 inches deep for adults. If you're trained, the ratio is typically 30 compressions to 2 breaths. If you are not trained in managing the airway, then you are going to do compressions only. Allow complete chest recoil, minimize interruptions. What's in your emergency kit, you ask? Oxygen, ammonia inhalant for syncope, epinephrine or EpiPen for anaphylaxis, diphenhydramine or Benadryl for non-life-threatening allergic reactions, nitroglycerin for angina, albuterol for asthma, aspirin for myocardial infarction, oral glucose gel or concentrated orange juice for hypoglycemia, and naloxone or Narcan for opioid overdose.
Now, this kit should be maintained weekly for expired drugs and daily for oxygen. Know this for your exam. All right, y'all, and that's chapter 31 straight from a textbook. No fluff. Now, if you want to practice testing with real DANB-style questions, check out the Ultimate DANB Certification Study Guide in my description box. We've got over 375 questions with answers and rationales to help you prepare for exam day. So whether you're taking the RHS, GC, or ICE exam, that guide is going to help you pass on your first try. Link is in the description box, and I'll also pin it in the comments. If you have an exam coming up, drop your date in the comments. I want to root for you. If you find this video helpful, hit that like button. But don't forget to subscribe and share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.